Hi, this is Facial Video. We are going to discuss initially what we do before we greet the client. So even before your appointment arrives, the first thing that you have to do is disinfect your workstation, the bed and equipment using a disinfectant wipe, and you follow the manufacturer's instructions to do that. You want to check all of your equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You'll gather clean supplies needed for the facial service, storing in a clean, closed container. You're going to turn on the hot cabbie and stock it with at least 3 clean, wet towels. More may be needed depending on the service and the client's needs. You're going to fill clean steamer glass with distilled water, and you're going to preheat the steamer. You will dispense products needed for the service according to the skin type and client's needs as follows. You'll prepare your disposable portion cup or tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup or tray. Or you can remove the product with a disinfected or clean single-use spatula, something like this, and then close the lid to the product and set the portion cup and tray on the tray. You're going to drape your facial bed with 1 fitted sheet, 1 flat sheet, and 3 towels. You'll place clean laundered sheets down on the disinfected facial bed. You'll place a towel horizontally at the head of the bed. You'll lay a hairnet and a headband on top of the first towel, along with a roll towel to support the head and neck of the client. And you'll save the third towel to lay across the client's décolleté. And then you're going to have your appointment arrive. You're going to greet your client. Your hands are already washed, but we're going to do that again in a minute. You're going to greet your client and you're going to escort them to the work area, and you'll determine there the client's preferences, and you'll assess the client's needs. You'll assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, an infection or infestation to prevent from safely performing the service. You'll assess the client's consultation form for any medications and products used within the last 72 hours, and you'll consult on any known allergies. You will consult with a client on any facial surgeries within the last 3 months, and if the client's under a physician's care. You will assess if the client is prone to cold sores or fever blisters. You will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc., encouraging SPF. We will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. And then if the client is free from all of the aforementioned contraindications, you can move forward with the procedure. So you're going to take her or him to the facial room, and you'll have them disrobe appropriately for the service. You're going to get them comfortable. And you're going to get them all tucked in to the facial bed, and then you will get your rolled towel and you'll place it under the neck. You'll put your headband on for the client, the hair out of the face. And then you'll put the towel on the décolleté. And you can see that over here I have already set up my tray. And I'm ready to go. And now I need to wash my hands. So the first thing that I'm going to do is I'm going to turn on running water, and I'm going to wet them. And then I'm going to put a coin-sized amount of cleanser in my palms, and I'm going to rub them together to wash them nicely. I'm going to wash the back of my hands as well, all the way down to my wrists on both sides. You'll be rubbing washing between your fingertips, of course, and between the thumb and the fingers. You'll wash the backs of the fingers. You need to wash your fingertips and your nails. Interlocking for minimum 20 to 30 seconds. They're really, really good. You're going to wash your thumbs, washing your wrists. And then you are going to thoroughly rinse them under that water, getting off any excess. Once it's properly rinsed, you'll grab a paper towel. You'll turn the water off with the paper towel, and then you will dry the hands. You will discard the paper towel in the trash, and then you will finish your hand wash with your sanitizer before you begin your facial. So we are going to begin by initial cleanse. And we're just going to start by removing makeup. First cleanse. Now, after this first cleanse is when we take a minute to analyze the skin. So what we need to do first is just bring some protection to her eyes. So we are going to cover those eyes up, and we are going to pretend like I'm going to bring in a magnifying lamp, which I do not have. So I'm going to bring over the magnifying lamp over her, turn the light on, and this is where I'm going to investigate what's going on with the skin. And so what I'm really looking for here is anything like excess sebum, fine lines, maybe dehydrated skin or flaky skin, anything like abrasions, anything that maybe we discussed, that hyperpigmentation that we talked about, freckling, when we did our client assessment. I'm really going to look and take a minute here to figure out what is going on. Also, that helps me with treatment, the recommendations moving forward, products for her at home, all different kinds of things based on what I see here on my skin analysis through the magnifying lamp. So I'm really going to take my time here and make sure that's properly done to see anything that I need to see that I want to discuss with her later. So skin looks pretty good. A couple things that we do want to talk about later. I'm going to turn my light off and then just push that out of the way. And then I can take off the covers for her eyes and place those out of the way. So we have to go to our second cleanse. We're going to remove the second cleanse. Third cleanse. And she is cleansed. We got to remove all that. Third cleanse. So we've done her 3 cleanses, and now we're going to tone her. Beautiful. So she's cleansed and toned, and now we're gonna start exfoliating. The exfoliation process. And obviously we're gonna be doing all of this based on manufacturer's instructions, and also based on the type of exfoliant that we're using. But based on that, we're just putting it on first, and then we are going to begin a little massage of it. So with this 1 to 2 minutes, we're going to massage it in to the skin. Okay. We've got our exfoliant on, and now it's time for us to retrieve our facial steamer. So I'm going to be pretending here because I don't have one, but we would get our facial steamer and turn it to the on position, and we're going to bring it over to the bed, but we are going to keep it turned away from the client while it warms up. So that allows the water to heat up, and then it'll emit an even flow of mist. When that's ready, we can aim the steamer mist position about 16 inches over the client's head, and you're going to want to place it towards the chin so that it'll evenly go up and evenly distribute over the face. And then you're going to leave it there for 3 to 5 minutes. But because we're doing a video, we don't have the steamer, we're not going to leave it there for 3 to 5 minutes. But that's what we would do in the real setting. Once the 3 to 5 minutes is done, we will remove it from her face, obviously, and then you can turn it off and place it in its previous location for disinfecting. So we've done that. So we're going to pretend like we did our steam 3 to 5 minutes. We've taken it away, turned it off, and it's there for disinfection for after. And then we're going to remove the exfoliator. I also don't have a hot cabbie with towels in it, so I'm pretending I'm going to grab my hot towel now. And because it is hot, you're going to want to open it up, check it out a little bit, and before you even get it anywhere near the client, you're going to check it on yourself, and you're going to check it on your wrists. And when that feels comfortable, you're going to take it to the client and check it on their collarbone. And she says it's great. So now we can take our towel and apply it to the client to remove this exfoliant. We're going to leave the nose out. so that she can breathe. Gorgeous. And her skin is beautiful. Exfoliate worked really well. So what we're going to do now is we're going to take a minute to do something called extraction. And in order to do that, we need to put on a pair of disposable gloves, if not already wearing them. And there are two ways that you can do extractions. You can use wooden sticks ending in cotton with soaked in astringent, and then I did that for my last video. So this video I'm going to use 2 cotton rounds soaked in astringent with my hands. With the cotton tipped, you're going to have to get a new pair every time. With this, you just work your way around. So I'm going to go in and work on my extractions. And with extractions, no more than 5 to 7 minutes, because it can be very uncomfortable for the client, and you don't want that part of the service to go on for too long. And then we're going to toss not only that, but our gloves as well. So you got to get rid of your disposable gloves, and you got to get rid of your astringent soaked cotton rounds, or you would have thrown out each set of those wooden sticked cotton ball or Q-tips, excuse me. For each individual extraction, you would use 2 new ones. getting rid of my gloves. And we will finish the extraction with toner. So we're going to go in the extraction step with toner and follow up with toner. That's what we're going to do next. And best news is, after all that extraction, is that your next move is massage. So after she had a little discomfort, she's going to feel really amazing because we're going to take the time to do a beautiful facial massage for her. You want to make sure when you are getting your massage lotion or oil that you get enough at the first go for the entire massage, so you're not dipping back in and out or having to stop to get more. That's what I meant to say. So I'm just spreading it out before we begin, so it's in all the right places. keep her headband back on. I don't know if it's gonna stay, but I'm gonna put it back on. None of these are staying. Now it's just a slippery mannequin head, a little bit different than a human head. But. Okay, so we need to remove our our massage product before we apply a mask. So now I'm gonna get my mask on my client. And I'm being careful to avoid the eyes, to get it in the nose, you don't want that, or the mouth. And with your mask, what you need to know is that you would follow manufacturer's instructions, of course, but you're going to actually, based on that, it will sit anywhere from 5 to 10 minutes on the client's face, which we're not going to do because it's video. So what has to happen now is that we have to remove the face. So just keeping that in mind, that we are not actually doing that, but we would if we were in the actual facial process. We would leave that mask on for the time allotted. skin looks great. Her mask has been removed. And now we need to tone. Before we finish the service, we're going to apply a little eye cream to start. We're going to apply a tiny bit with our ring fingers to the zygomatic arch and the brow bone. And it is daytime, so we are going to also apply some moisturizer, but we're going to apply moisturizer with SPF, of course, because she's going to go outside and we don't want anything at all to be exposed to the sun that we would not want to be. So her face, it's going to go all over her face, neck, décolleté, if that's exposed, ears, if that's exposed. Anywhere. We want to make sure we get SPF moisturizer everywhere. Another little touch would be to maybe apply some lip balm to finish it out. And upon completion of the facial, we would give the clients a privacy, let them change back into their things, and then we would meet with them, get them checked out, discuss maintenance and aftercare, make sure all of our single-use items are discarded. We're going to place implements in a closed container labeled to be disinfected, like our fan brush that we use for the mask. We'll place any towels, the cape, any sheets that were used into a closed container until they're laundered. We're going to clean our work area and disinfect. So what we do for that is we would identify a proper cleaning agent and read the manufacturer's directions. We would follow those manufacturer's directions for mixing and usage. We would wipe down our workstation area with cleaning solution to remove debris. Then we would identify the disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in salon setting. We would follow the manufacturer's directions for mixing and or using appropriate aerosol disinfectant. We would disinfect electrical equipment and then store it in a clean area separate from other implements. And because we used a product that's bactericidal, virucidal, fungicidal, we would be removing our gloves before we do a final hand wash. So we would turn on the water and wet our hands, and then get a coin size amount of the liquid hand soap, washing our palms together down to the wrists. We would wash the back of our hands down to the wrists. We would wash between our fingers and between our fingers and our thumbs. We'd wash our fingers thoroughly, the backs of our fingers. Fingertips and nails would be washed. Thumbs would be washed. We would be doing all of this for a minimum of 20 to 30 seconds, minimum. And then we have to do our wrist, proper rinse. Once everything is completely rinsed, you grab a paper towel and you turn the water off with the disposable towel. Then you're going to dry your hands thoroughly and discard the paper towels or the towels that you dried with. You're going to grab hand sanitizer to finish, and then you're going to do all of that process with your hand sanitizer until your hands are dry. And then you can set up for your next appointment, or you can go for the day, depending on what your schedule is. And that's the facial, basic facial.